Thank you. So welcome to our webinar for the Mentally Healthier Councils Network. I'm Shizana. I'm the Mentally Healthier Councils Network lead at Centre for Mental Health, and I'm going to be chairing this session. So we do have a very packed agenda, which has been changed very last minute. So I'll keep an eye on the time and prompt our speakers as we go along if we are running quite tight. As we have a slight change to the agenda, I'm not going to introduce everybody now. I'm going to introduce everybody as we move along the agenda. You should have all received the agenda anyway, but I can paste that in the chat as well. So, Andy, I'll hand over to you.
Helps if I put my camera, take myself off mute, doesn't it? Can you see my slides? If you can, we're winning. Fantastic. Well,
Thank you.
that's a good start, isn't it? So, I'm Andy Bell. I'm Chief Executive of Centre for Mental Health. Very proud to work in the host organisation for the Mentally Healthier Councils Network. And massive thanks from me before I get too stuck into this to everyone for being part of this today and for being part of the Mentally Healthier Councils Network. We love that you want to be with us on this journey, and particular thanks to my colleagues Shizana and Ed and Hannah for putting today's event on. It's an absolute joy to spend time with you. So I was asked to give a bit of background to the current position in terms of where we are in terms of the nation's mental health right now, what we know about the nation's mental health, and what we know about mental health policy. What is it, 7 months or so into a new government now? I hope that will be useful to you, whether you're an elected member of a local council and therefore thinking about this from a political point of view, or someone working for a local authority and thinking about what that might mean for your job. Hopefully, you know about Centre for Mental Health because you have been part of our. Now that's not much fun. I managed to fail to put the right screen share on, so I can't move the slides on, Shizana. That's absolutely inept, isn't it? I'm going to try one more, and we'll see if I can do it properly this time. It's all very impressive, isn't it? So, apologies. This is very complicated.
Free to share, Andy.
Yes, please. I'm so sorry. That
That's
really is
okay.
very disappointing. Failed at the first hurdle, everyone. So while we're waiting,
I've got the same slides as that you've just shown.
yeah, I couldn't move it on.
Oh, okay. Let me do that
Okay, I
now.
was stuck on the home slide. Honestly, we did try this earlier and it worked perfectly.
Yes.
So I really am doubly inept. Um, so when we get there,
Right.
um, I will tell you all the exciting stuff you're going to get to find out. So if you can go on 2 slides, Shizana, because hopefully everyone here knows about Centre for Mental Health because you kindly joined us for this. Right, I'm going to start with some difficult facts. And this is something we talk about a lot, but it's important to say that from all the evidence we have available to us right now, we can say with as much confidence as we ever can that unfortunately the nation's mental health is getting worse. I know that's pretty harsh. We're starting with the difficult stuff, but we can see from a number of different types of evidence, including national well-being surveys. There was some new information just earlier this week showing that levels of anxiety are higher among people of all ages, and overall well-being has been going down, not steeply because changes to well-being across the whole population don't change that markedly over time, but there has been a decline. There are more people who, in surveys, particularly for children and young people, are reporting having poor mental health. We don't have up-to-date survey data for adults, so we'll have to wait to find out about that later this year. But we are also seeing more people seeking disability benefits with mental health as being one of the main reasons. We're seeing a very steep increase in referrals to mental health services. And we've seen signs in schools, particularly rising levels of absence within schools, all of which tell us together that things are getting harder for people's mental health and well-being. Next slide, please. This will get jollier, I promise. We will come on to some more positive things. Sorry, Shazana, is it
Oh,
possible to move on? Or are you having the same problems I had? Oh, there we go. Before it does get more fun, it's going to get more bleak. Um, and we calculated last year the economic and social costs of mental ill health, and they've reached £300 billion. That is a huge number, but to give you some context, in the year we counted it, 2022, the NHS budget was around about 150 billion. So this is enough to run the NHS twice. Um, and most of that cost falls on individuals and families. Some of it falls on health and care services. Some of it falls on businesses. There are lots of different places where these costs ultimately come to play, but the majority of cases, it's people losing out financially or in terms of quality of life that these costs fall. And what that means is this is a very big economic and social problem, and that tackling it is good value for money. If you do the right things for people's mental health, it's economically good. It will be beneficial to everybody. So it's important, hopefully, to know about this. And I hope this is the kind of information that you'll find useful when you're making the case locally for wanting to bring about better mental health. Next slide, please. So, despite that, there's been an awful lot of work. I'm not going to go through these things in great detail. You will be massively relieved to know. But we often talk about mental health having less of a profile of late and being less of a priority for government, and that's something we have observed. But look at the amount of policies that have come out. This is roughly one a year for about the last decade. There is an awful lot of policy about mental health, and there's more to come. Um, we can talk about what some of these documents are about, or we can have conversations separately to this event. But as you'll see, there's been a lot of attention paid to it, some of which has brought investment, some of which hasn't. Next slide, please. And in terms of where mental health services are, well, there's good news and bad, as you might expect. While the nation's mental health has been getting worse, we have also seen some investment in mental health services. When we look at adult services, for example, there are more people than ever now in contact with mental health services. Around about 1 million people a year receive NHS talking therapies. This is in England. Around about 600,000 are using specialist community mental health services. Much smaller numbers are in hospital for their mental health. And we have seen some significant developments, for example, providing perinatal mental health services for women in the perinatal period when they need specialist support, helping people with mental illness to get jobs. There are a number of different areas where we are seeing some growth and new services appearing or increasing the ones we've got. Next slide, please. Similar picture for children. For the first time, spending on children and young people's mental health services went over £1 billion last year. Now, £1 billion sounds like a lot of money, doesn't it? But remember, the NHS budget is something like 180 billion. So this is relatively small by comparison. Nonetheless, more children and young people are seeing mental health services. There are mental health support teams in around about half of schools now, and we have seen a very big growth in the workforce. However, next slide, please. Mental health services are also under enormous pressure. As fast as they can grow, demand or need is growing about twice as fast. Um, Particularly where the kind of services that councils run that keep people well, and you've been under such enormous financial pressure that some of the lower level support that local authorities are responsible for, where that's been disappearing or reducing, that just puts more pressure on the NHS. It's bad economics, as well as being bad for people. If you lose early support and then people's mental health gets so bad, they need to go to the NHS for help. And we know that there are around about 1.5, possibly as many as 2 million people now waiting for mental health services. They're not given the same level of importance by government as those waiting for elective physical health care. And the longest waits, by far the longest waits, are those for neurodiversity services, particularly autism and ADHD. That's where we're seeing the very biggest waits for both adults and children. We also know that many of the mental health hospital beds we've got are overcrowded, outdated, some of them are unsafe, and some cases, children and adults are being sent far from home for a hospital bed, which we know is unacceptable. And again, some very interesting and important developments about the relationship between the NHS and social care. around mental health. They have to work hand in glove to provide good mental health services, but in a lot of cases, that relationship is now getting really difficult. Next slide, please. So the government has made some big promises in its manifesto. It promised 8,500 more mental health professionals in order to reduce waiting times. That's good. A mental health specialist in every school. Early support hubs for young people, which we really welcome and have been campaigning for a long time, and to reform the Mental Health Act. And that's now in Parliament right now. It's not being debated right now, but it's in the midst of its process right now. Government also, I think, since coming into power, has been very concerned about the public safety elements of mental health, particularly since the terrible events in Nottingham that have been reported on just last week. And they're very concerned about what is described by some as economic inactivity, people unable to work because of their mental health, particularly among younger adults. Next slide, please. So where are we? Well, it's a mixed picture, isn't it? We've been promised parity. The King's Speech promised parity, but we're not seeing much signs of it. In the recent NHS planning guidance, we didn't see much sign that mental health is really a priority, but maybe it will be. We don't know where we're going in terms of funding for mental health services. It has been protected from being cut next year, but it's certainly not showing any signs of growing. But we will have a new Mental Health Act soon. We await reform to social care. We're pleased that the public health grant for the first time has gone up a bit for the year to come. We hope that will be the start of an uplift that will continue, and we'll continue campaigning for that. We desperately need investment in new mental health facilities to replace the outdated ones we've got. And what we would love to see, and what many councils do, and we'd like national government to do too, is to have a whole government approach to mental health, to put mental health at the heart of the decisions it makes and the way in which government happens. We know that lots of you do that in local government, and we love to hear about it when you do. What we'd really like to see is that happening nationally, and we will keep pushing for that. But that's a quick run through where we are in terms of the current picture nationally. I hope that is helpful.
Lovely, thank you, Andy. And sorry for any technical issues that we're having in the background, but we're trying to deal with them the best we can. So great on timing. Ed, can I hand over to you? You're on mute.
I'm just trying to follow Andy's great example with the tech. Sorry, Andy. So I'm not on mute. Hopefully you can see my opening slide. It goes forward. Excellent. So I'm doing better than Andy on that front. Thanks very much, Andy. That's a brilliant overview of where we are nationally. And now I'm just going to briefly talk about some of our local work, including with the network. I'm really proud to have been associated with Centre for Mental Health's local government work since the beginning of the local government mental health challenge, which I don't know was about 12 years ago. I was the second ever mental health champion, which I was very proud to be involved with then and continue to do so now. So since the launch of the Mentally Healthier Councils Network, which you are all wonderful members of, we've gone great guns. We've now got 357 members in all 9 regions of England, and we're covering nearly every of the 154 upper tier councils in England. And if you're from a district, you're very welcome too. Thank you very much for being with us. You're very important as well. And that's we had over 100 members of the old scheme, the Local Government Mental Health Challenge. So obviously that was only open to elected members, and this is open to elected members and officers. But you know, it's huge growth, which we're very proud to have you all involved. And we've got like lots of different bits of councils involved, public health, obviously, people involved directly with mental health, but also social care, housing, and other really important areas of councils that don't necessarily consider themselves always to be involved in mental health, but nearly everything a council does affect your residents' mental health, and you're all very welcome, as are elected members, obviously. We've held 9 regional launch events. We thought it was really important to at least electronically get all over the country, if not physically. But we did have a national event last July in Southwark Town Hall, and the London regional launch there as well. And in total, we've had over 300 people attend various events And we've got a really successful monthly newsletter. One thing I know about local government people is you don't get enough emails. So I'm sure you welcome another email in your inbox just once a month, but it's got really good open and click through rates, which shows that you value that. So please do continue to look out for that and don't send it to your spam. Our plans for 2025, this is the first of this calendar year, a series of webinars. We'd love to know what interests you, what you want to hear about, and anything you want to share. If you're doing something particularly interesting in your area, we'd love to give you the opportunity to share that. We are going to do a Mentally Healthier Councils accreditation scheme, which is really exciting. I know from being an ex-elected member how great it is to get badges and things for your council and awards and stuff, but it does genuinely drive change, which is the main thing. There is a survey. We're going to post the link to the survey. We'd love you to fill that out. It only takes a few minutes, and you can share your own ideas as well as sort of select from a menu. I'm going to give you a few of the early results shortly. We'll produce our manifesto in about March next month for May's local elections. There's always elections somewhere. I know some have been delayed because of local government reorganisation, but we will be producing our manifesto for that. And we'll also later in the year be producing a report on mentally healthier council policies. And again, we'd love you to share your examples of policies that you're doing in your area. It could be directly to do with mental health, but it could be the things that also support good mental health, like poverty reduction or environmental improvements. So do share those with us as well. And we're going to be growing the network further and taking into account the fact that local government's going to be going under, being reorganised with changes to the kind of tiers and stuff like that. So we'll consider what that means for the network. But please do encourage your colleagues to join. We'll share the link to the joining form that's very quick and free in the chat as well. So here are just a few of the headlines from the Mentally Healthy Councils Network accreditation survey so far. I'm not going to go through all of this because I'm running out of time, but these are the sort of top answers so far that people have selected. We'd love many more people to get involved and vote for the ones you want. There's also text boxes where you can add your own ideas. I've bolded the ones where Centre for Mental Health can directly help you with things like mental health training, I'm going to talk about in a sec, independent placement support, where we support people with mental health conditions into work and to stay in work, and things like that. So do get involved with the survey. Then briefly on my side hustle, as the kids call it, that we're going to hear from Dr. Aaron Sherry, who's done an evaluation for the National Institute for Health Research on this training. Do get in touch with me if that's of interest. I will post my email when Dr. Sherry talks about it, but that's been really successful in training councillors and officers on how to look after their own mental health better, but also change their council's policies to look after their residents even better. And we're also going to hear in a minute, when I shut up very quickly, from colleagues in Greater Manchester, where Centre for Mental Health have done, we did about 2.5 years worth of work commissioned by the Greater Manchester Health and Social Care Partnership. So working at that level, ICS, Integrated Care System, and Combined Authority kind of level, which is of more and more interest, I think, to a lot of people, but also working directly with 7 of the 10 local authorities in Greater Manchester, which we're going to hear from 2 of them very shortly. And from that, we've done complex system mapping workshops in Bury, Trafford, Wigan and Rochdale. We've worked with Bolton. I noticed their mental health champion counsellor is in the chat, is in the meeting. And we've worked with them on summarising that. And we've done a series of workshops in Stockport. And we're going to hear from City of Manchester on the bit of support we gave them on their mental health strategy. Here is a beautiful complex system map. We've sort of refined this methodology from working in Greater Manchester. This is for a mental health needs assessment we're currently doing in Greenwich. If that's of interest, do let us know, do get in touch. So do fill in the accreditation survey. Tell us about any of your great policies and anything you want to hear about via the network. Book your better mental health training. Commission us to help with your complex system mapping, independent placement support, mental health needs assessments, co-production, or anything else you think we could be of assistance with. And do get your colleagues to join the chat. I am now going to hand directly over. Hopefully, Jim McGlynn from Bury Public Health Team is in the meeting.
Thank you very much.
Oh, great. Nice
I'm
to see
here.
you, Jim.
I'm here.
Hooray.
The
Thank
technology. God. Yeah, we've discovered all them bits that NASA, used to get people on the moon, allegedly, or whichever way you want to look at that. And I've used it now to get them here. So I might have to go at past and try and transport this to the car. So bear with me. I promise this will only be 5 minutes. I'm going to really trip myself up now and try and share something, as we usually do Teams meetings, but we're on Zoom. So please bear with me. Let's hope this works. So I'm going to try, and I've got the share there. I don't know if it's sharing or not. Let's do it off my screen. Bear with me. It's not going to work probably, but if not, don't worry, because I can do it verbally. Can you see that, Ed? Is it working?
Not yet, Jim.
No, sorry. Let me just have one more go at doing it on Zoom.
Jim, I have made you co-host, so you should be able to share.
Should be able to share.
There should be a share button down the bottom.
Got the share button, yeah. And usually
I'll
just do it off my screen.
If you want to email it to me, I can share it.
That's great. Shall I do that very quickly?
You can do.
All of us having problems sharing our screen. Next time we'll do a master slide deck. That's what I should.
I don't really need it. It's just better if I do it visually, I think. But if you just bear with me, sorry. Attach a file. Sorry, we'll get there. Ed, I'm just going to send it to you, Ed. Sorry, because it'd probably be the quickest way to do it. If you can, are you okay sharing it from your end?
Yeah. Let me open my.
I thought you was too cocky. Thought I was going to be able to do this. And it will be simple if someone showed me. I've not used Zoom for a long time. Has the pigeon landed?
No, not yet.
Not yet.
Why don't you crack on, Jim? And if
I will crack on with it. What I'll do is I'll talk you through it verbally, because I was going to do that anyway. So basically, yeah, got in contact, or Ed got in contact with ourselves over at Bury around possibly doing a mental health complex mapping system. Didn't really understand what that meant until Ed described it concisely for us, which was great. And it was needed. So I came into post in public health in 2020 in the mental health and wellbeing and suicide prevention role. It was a blank canvas of a role, so I wasn't inheriting it. And I thought, yeah, we need to do a needs assessment. Now, bear in mind, my mental health world is prevention, not so much primary and secondary care, although we do tip our toes in the water there. So this is what was needed. And again, as we do in public health, try and keep it person-centred. So we got all the stakeholders around the table to say, right, where are we? What assets have we got? What do we need? Does everybody know about these assets and so on? So with direction, which we needed off Ed, which was very well welcomed, we started off basically doing this workshop event. So we did 2 workshops. One basically was looking at getting people around the table to say, right, what are your thoughts on what we've got? And then how we're going to use all that information that we've been given to drive this forward. Really well represented. Some things aren't in Bury. We're quite a small locality, so you don't always get full representation. But we pretty much did at these workshops, which is exciting. This kind of like fed from what we call our coping and thriving model, Thrive model. So we have 4 sections in our coping and thriving. The Thrive model, which is coping and thriving initially, which is where I sit. So this is kind of like early intervention work. How do we take the learning from people that are coping and thriving with mental health? And then obviously we go into the next segment where people need a little bit more help getting help. And then going into the more serious areas where we're talking primary, secondary care, and then crisis. So we were looking at these early interventions really. What do we have? What do we need? So from the workshops, we've broken it up into, and again, this will be familiar to people where Ed's footprint was around how you did this probably. So apologies if I'm repeating what's already going to be said or has been done, but we were looking at kind of like the mental health as the core, and then the social community side, environmental side, physical stroke behavioural side, and social economic. We got real good feedback. And to be honest, what really surprised me was the feedback that we got given probably wasn't the feedback I was expecting. So this really does be an advocate for not putting a wet finger in the air or working on presumption. So we got all this data, we got all this intelligence and information, and we put this into an action plan. So rather than just have people come and stick, onto flip charts and say, we promise we'll do something, but we don't know all about it, we put it into quite a concise Gantt chart, if you will, an action plan. So within that, what we did is we broke up the 4 segments. We looked at what people were saying, this is where we feel things are working and maybe aren't working. This included all the wider determinants. We even put in a Maslow's tier chart so we could identify that again of need and put it within them tiers. We Gantt charted it as well, and it's a living and breathing document. So this is, for us, absolutely 2 things have come from this. A, this action plan is a living, breathing document. We're working off that and we've got some direction, which is brilliant. And we can feed that back to partners to say, you came to this workshop and look what we're doing. You said we did. And in Bury, we have what we call a let's do it policy. That's our strategy. So we are doing it. And again, it's person-centered. Some of the recommendations, I'll be honest, were unachievable through funding and resource, but at least we've got them recorded and our ducks are in the row. Because like when Andy were alluding to before, if we do get funding and we do get resource, then we've got our ducks in a row to say, well, this is what we said. We did a briefing paper. We sent that to up through our hierarchy to our mental health and wellbeing board, and that was well received. And also we've sent it out to all the stakeholders as well, again, for them to have a look at. So if anybody wants that sharing at any point, please email. I'm willing to share that also. And then also what we do have is what you just alluded to there, Ed, on the complex mapping system that you're doing elsewhere. We created this digital one that sits on our directory, our Bury directory, which is a digital platform for all things health. And it's an interactive tool. So the interactive tool is absolutely amazing. We've got mental health in the middle. We've got strategies coming off there. We've got the environmental stuff. What are we doing, basically? So the action plan is a living, breathing document that professionals can access, but also the public can access at a layer level as well. So yeah, that's where we are really. Apologies, I've not been able to do that on a slide deck there because it's not come up, but that's where we are. And I think that for me, if we hadn't had that, yes, obviously we would still be doing mental health interventions and practice, but I don't think it certainly wouldn't have been as person-centered. It would have took a lot longer to get the people's voice and the services voice. But we've got it on a page, so we can see it. It's living and breathing. It's working. Yeah, and I can't thank Ed enough really, and the Centre of Mental Health for helping us out with that, because it will continue. It will continue. It'll be a legacy for future people to be able to get hold of and work with. Is that longer than 5 minutes? Is that everything that we needed to cover? Any questions?
Perfect, Jim. We're not going to open it to questions quite yet, and I know you're going to have to leave that room, but I think I managed to share the slides while you were talking. I don't know if you could see.
All right, sorry. So probably
no problem.
Yeah.
Thanks, Jim.
And I have learned that I need Zoom training.
No.
Thanks for listening. I hope that was useful for people. Thank you very much, and thanks again for all your support.
That's brilliant, Jim. Thank you for making sure you could get to us as well. So, great, dead on time as well. So, Lydia, can I hand over to you?
You can. The latest to show my shortcomings in dealing with Zoom rather than Teams. So, okay, let's see. Is that sharing? The wrong page, but
yeah, we can see it. Yeah, that looks good.
Yeah, excellent. Right. Yeah. Hurrah. Okay, so I'm just going to give you a quick 5-minute overview of Manchester's strategic framework for mental wellbeing, which is something that we've been developing over the last year or so, probably a bit longer than that. I'm a public health programme lead in the public health department in Manchester City Council. So Manchester, fantastic, diverse, exciting city, but we have some substantial health inequalities issues both within Manchester and between Manchester and the rest of the country. We have somewhere in the high 40s young people living in poverty, children and young people living in poverty at the moment. So we are, since COVID, we've been very keen to focus on what we can do to start really kind of addressing those health inequalities that people in Manchester are experiencing. And we have developed the Making Manchester Fairer plan and the city's anti-poverty strategy, which sits within Making Manchester Fairer. And within the Making Manchester framework, we have a work stream focused on prevention of ill health and preventable deaths, both physical and mental ill health. So that's just a very quick bit of context for you. So what we wanted to do as part of our preventing ill health and preventable deaths was to start focusing in on how we can develop our framework for public mental health, which isn't necessarily a term I use that often, but for all of the things that need to happen in the city around supporting people's mental well-being and preventing people from becoming mentally unwell. So again, like Jim said, very much that kind of preventative upstream focus that we're looking at. So as part of that process, we started having some listening events late in 2023 where we invited lots of different community groups, services, people with lived experience to tell us about what the important issues were for them around mental health and well-being. And then following that, we started working with Ed from the Centre of Mental Health on developing a co-production workshop. So we took all of the information that came from the listening events and started forming that into some kind of key themes that we needed to look at in terms of preventing mental ill health and promoting good mental well-being in the city. And we put that together in a co-production workshop, which we held in March of last year. With around about 60 people from a whole range of different organisations across the city that came to that, including the steering group and the wider mental health and wellbeing network that we established to lead this work. We then followed that up, so that kind of shaped what our framework would be, and we followed that up with some more consultation work, particularly with our community health equity structures. So we have a lot of different sounding boards for different communities, so we talked to them about some of the issues around mental ill health and mental well-being for those communities, and we fed all of that also into our framework. And then finally we took it to the Health and Wellbeing Board for approval in June of last year. So in terms of the workshop that we did with Ed kind of helped us put this together and start thinking about how we could gather the most useful information from people within the city. So on the left of the slide, that's just our kind of overall approach to what we wanted to achieve from our mental wellbeing framework. And in the bottom left-hand corner, that is essentially what our framework is. So the framework is around how we create the conditions in the city for good mental health and wellbeing to thrive, how we protect people from the impact of poor conditions, whether that's poverty or other things, how we strengthen how we work together and with our communities, and how we support people at the right stage with the right things so that their mental health doesn't deteriorate, particularly for people living in challenging conditions, which a lot of people are in Manchester. So the focus of the workshop was around kind of all of the different things that impact on people's mental health and well-being, the social factors, the environmental factors, access to support and care, and how mental health and well-being is interlinked with how people kind of respond to their situations and health behaviours. So we had some really deep and interesting and insightful conversations about all of those issues. We probably again tried to pack in far too much in the time that we had available, but it was an incredibly useful process that we went through to do that. Since then, in the last kind of 10 months or so since then, we have been focusing mostly on how we develop the children and young people's kind of strand of our mental wellbeing framework. So we're currently working towards accreditation as a child-friendly city for Manchester, and within that we have a healthy badge mental wellbeing priority work stream. So we've kind of linked the work that we're doing around children's mental health linked into that. We've just held a specific children and young people's mental health and wellbeing workshop, and we're setting up a network for practitioners who particularly have a role around children and young people's mental health in a fairly broad sense. So this is beyond just CAMHS, it's a whole range of different kind of practitioners. We're in the process of updating our children and young people's mental wellbeing joint strategic needs assessment so that we can have a more kind of inequalities, social determinants focus on all of the things that impact on children and young people's mental health and wellbeing in the city. We've been running for the last kind of 18 months through Making Manchester Fairer, a young people's mental health Kickstarter, which is a fantastic project delivered by 42nd Street, who are Greater Manchester's young people's mental health voluntary community sector support agency. They have been doing some targeted work with young people in deprived and marginalised groups who are waiting huge amounts of time to access the treatment and care that they need for their mental health issues. So they've been doing some targeted work with those young people to keep them safe whilst they're waiting for the treatment that they need, but also doing some fantastic work around training practitioners in youth services and other organisations who are coming into contact with young people who've got a whole range of different issues and need support. And those practitioners have told us, you know, that they see all of these things going on, but they don't necessarily know whether they're doing the right things to support those young people. So we've done some fantastic training. Part of that has been 42nd Street recruited 3 youth practitioners who have been co-delivering that training and developed it, and they have been the most fantastic asset to the city and have kind of popped up in all sorts of different places, and we're hoping that we can keep that going. And the other thing we're planning at the moment is how we do some more engagement work through the Child Friendly Cities work, not just around mental health, but just lots of different engagement work with children and young people, so that their voices are absolutely at the heart of whatever it is that we develop from here. And what we hope that we will be working towards are things like mental health, early help hubs and things like that. So that's no idea whether that was the time or not, probably a bit longer, sorry. That's me.
That's brilliant. Thank you, Lydia, and thanks for the update. We are having a few technical issues allowing one of our speakers in, so I'm going to have to move on and ask if we can go to Charlene. Charlene, are you ready to speak? So Charlene's the policy manager at the Health Foundation, our amazing funders. So they're the ones that have allowed us to make all this happen. So Charlene, if you are ready, then can I hand over to you?
Yeah, absolutely. So yes, thank you very much, and great to join the session this afternoon. So yeah, I'm joining from the Health Foundation, and we are, as was mentioned, we're supporting the Mentally Healthier Councils Network. And for those who aren't familiar with the Health Foundation, I'll just set out a little bit about us and why we're supporting the network. Our mission is to improve health in the UK and address health inequalities. And we do that by funding new practice, developing new evidence about the problem of ill health in the UK, but also very much focused on developing effective solutions. And for the part of the Health Foundation that I work in, it's all about addressing the wider determinants of health. So building an understanding of how to tackle upstream causes, things like access to housing, employment, good quality employment as well, of course, financial security, access to good quality public services like transport, often shape people's health outcomes. And so we've developed a programme of work seeking to better support local authorities to take action to improve health and address health inequalities in their communities. We are supporting Centre for Mental Health in this network to improve health by engaging with yourselves as elected members and to develop a better understanding of what action you can take and, really effective action. So for us, we're focusing on the role of councils and the support that councils need, as, we think that to create a healthy society for everyone, we need the right building blocks in place. And, that is those kind of big issues like housing, good jobs, fair pay, and quality education. And, really, really important in terms of developing a preventative approach. Local authorities obviously oversee many of these levers. And as was mentioned by Andy and Ed, this is a really big year. Lots of opportunities to grasp the nettle and really try to tackle the entrenched issues behind the mental health problems that we see in the UK. So just to say, in the coming months, we will be sharing learning from the Health Foundation in terms of how the new levers, devolution changes, new powers for places and communities, how those should be implemented in practice to ensure that councils can play their important part in improving health. Also trying to really uncover some of the big challenges in doing that and kind of playing a bigger part, what kind of support we think central, regional government should be thinking about for councils. So not to add to your email burden, but you can also stay in touch with us about our other resources that are coming down the track through our local government newsletter. So I'll share a link in the chat. But I'll finish there. And yeah, great to be with you this afternoon and really enjoying all of the great practice that we've seen so far, and looking forward to some discussion hopefully as well.
Yeah, thank you, Charlene. Thanks for that update as well. And I am really pleased we finally have Dr. Aaron in the room. And I'm really, really sorry. We've had a few technical issues behind the scenes trying to get you in, but he's here. And I'm just going to hand over straight to you because we are short on time. But yeah.
Hi there. Hi, everyone. I've had to join on my phone. So I'm going to try and share some slides. I don't know how this is going to go, but let me just have a go. Just bear with me.
If you want, Aaron, you could email them to me like Jim did, and I could have a go if
Okay.
that's helpful.
Yeah, I think that would be helpful. Okay, one moment.
This is a lesson in having a master deck of slides. Although we had to change the order so much, we would have got into another different sort of tangle. Nonetheless, you'd have thought we'd have worked out how to use the tech by now, but there's always a
Yeah, I think I was accidentally removed, and then you can't get back in once you remove.
Oh, no.
Never mind. Okay, I've just sent them to you, so yeah,
All
look
right,
out for those.
I'll have a go. You bluff for me a bit, and I'll.
Okay, sounds good. So yeah, hi everyone. So yeah, my name's Aaron Sherry. I'm from the University of Nottingham. First Light Research Group. So we evaluate public health interventions from local authorities. First Light is a collaboration of 3 institutes. So it's University of Nottingham, Loughborough University, and University of Lincoln. So we work together as a group. And Ed's Council of Mental Health Training was assigned to our group to evaluate. So we provide pragmatic, rapid, they're called rapid, but they're probably not rapid, to be honest. It's all relative. Rapid evaluations of local authority public health services. So Ed's was assigned to our group, and that's what we've been evaluating basically. And I was going to share some results. I don't know if Ed's had any luck coming through.
I'm having to log into a Microsoft system. I've just got the verification code. So if you just
I'll keep talking, yeah.
I'll sort that out as quickly as I
Yeah,
can.
sounds good. So so what we do is very much co-development. So we work with the stakeholders. So that would be Ed, it'd be Thrive London, Greater Manchester Integrated Care Partnership, where we co-develop the evaluation for the stakeholders' needs, but also we try and maintain like scientific merit as high standard as we can, and they're independent evaluations. We also use PPIE, so public and patient involvement, in our research. So we developed a local group for that. So that was consisted of several counsellors based in London and across the UK, who kind of helped us understand the context of what is to be a counsellor in the different regions and all the different challenges. So we had 2 elements to the evaluation, 2 phases. So the phase 1 was Greater London. Okay, something's happening. And the second phase was Greater Manchester. Okay, great. I can see the slides. That's great. Excellent. So if you could just play that video, and then I'll tell you when to move on. This gives an insight into what FIRST is broadly. There's no sound, but when you share the video, you might have to, or share the presentation, you have to click a couple of buttons, don't you, to say share sound.
We can share these.
I think the video is probably a bridge too far, Aaron.
Yeah, okay. I think you're right. Let's move on. I've kind of explained what FIRST is anyway. So FIRST, there's around 10 groups around the UK. Here we go. Yeah, great. So we're First Light, as I mentioned. This is our group here. So just to mention a couple, we have Lauren and Flo. They are experts. Flo is an expert in mental health. They're both experts in pragmatic evaluation. So they kind of oversaw the evaluation. Next slide, please. So Council of Mental Health Training, I'm sure you're all aware of what that is. Training for elected councillors, initially for Greater London, and then later piloted in Greater Manchester. essentially a 2-hour online training session for counsellors to help reduce mental health inequalities across those regions. Next slide, please. That's Ed, of course. So the purposes of the training, it kind of splits into two, as many of you will probably know. The first half is more around personal mental health and how that can be effectively managed as a counsellor. And then the second half is more around mental health in the community and preventative ways to help protect the mental health of constituents or local residents through different actions. So it's the fundamentals of that, like the wider determinants, and then 13 practical actions that counsellors using their local powers may be able to adopt. That's the premise of the training. Next slide, please. So as I say, it's a co-development research process. So with Ed and the other stakeholders, we co-develop these research questions. The first one is around feasibility and acceptability. So is the training feasible and acceptable, which means the way in which it's delivered and its content, is that suitable, appropriate? Is it done in the right way? Is it useful for the trainees? And then acceptability is there an actual need for something like this type of intervention? Secondly, we looked at, is the training effective in terms of educating counsellors in the importance of mental health, personally and in the community, and how to improve it? And then thirdly, does it influence intentions and actions in counsellors towards the local community and actions they may be able to take? Just hit it one more time, Ed, please. So we use mixed method approaches because of this pragmatic approach. So we use a range of data that we collect. It was mostly with trainees, counsellors who had attended the training across Greater London and Greater Manchester. We use interview data with the counsellors, survey data, cost data. I won't present it all. I've just picked out some of the main headlines, basically. So London was retrospective. Greater Manchester was, we could collect some data before the training and afterwards. Here's an overview of attendance and costs. So 48 sessions in London, 4 in Greater Manchester. The entire areas, the entire regions, not regions, the entire areas were targeted. And in London, 30% approximately of all counsellors in those areas did attend the training. So the reach was good there. Slightly lower in Greater Manchester. Could be related to Thrive London, being based in London, and Ed's proximity and relationships as well. Next slide, please. So in Manchester, via survey, counsellors were asked what they wanted to learn from the training. The most popular, just hit the button again, please, Ed. The most popular was they wanted kind of how to, information on how they can implement actions in the community to improve mental health outcomes. That was the most popular request. Next slide, please. So from Ed's survey data after the training, across the both regions, generally, trainees were very satisfied. The vast majority rated it excellent or good, slightly higher in London. And overall, counsellors said the training was relevant, informative, useful, and engaging, and they enjoyed the interactive elements. It suggested improvements, generally speaking, it could have been more interactive and potentially split into two, one side personal and then another session on the community. Next slide, please. So we interviewed counsellors across London and Manchester. I've just picked out a few themes that are quite interesting. So this theme here, similar to the survey data, counsellors are saying that the training was engaging, satisfying, the content was relevant, and it was delivered by the right person. So Ed was the right person with his teaching style, believe it or not, his experience and background. So that was a real positive. Just hit the button again, please. So we've just got a quote here that I think this was quite a powerful quote, where somebody said that being a counsellor in local politics, the environment can be quite macho. You have to be strong. You can't really show weakness. However, many counsellors can struggle with the challenges of the role and with their own personal mental health. So in the training, they made it like a safe space to open up and have open conversations. And they realised it was okay to actually say that they need help and talk about their issues that they have. So they credited the training to that. Next slide, please. It seemed like for some, their knowledge, attitudes, and motivations weren't really changed from the training, but more reinforced. Many of the trainees were already aware that it's an important topic, mental health, and that they were motivated to do something about it. Hit it again, please, Ed. Some did say that the training was perhaps too generic in terms of personal mental health, and it should have focused on the specific, unique challenges of the counsellor role. And again, please. While they said the training was engaging, for some, their retention of the content when asked wasn't great. So that's an area that could be improved. It could be the way in which the online format or how they engage with online training, something to do with that. And again, please. And the way that counsellors came together, could share experiences was highly valued, and they would have liked the training to go a bit further with that, or more time spent on that element. So they can share best practice, case studies, and just learn from each other basically through experience was something that was ways in which the training could perhaps be enhanced down the line. And again, please. So from the survey, post-training survey in Greater Manchester, most suggested that they did start looking after their mental health following the training, which was encouraging, albeit a small sample for this survey. And around half said that they started taking action towards mental health interventions to benefit their local community. And again, please. When asked what these actions were, it was more around discussions in their different political groups rather than the specific 13 actions that was prescribed in the training. So there's a slight disconnect there on what the actions are in the training and the actions they actually adopt from this survey, any of this data here. Next, please. So in conclusion, and again, please, is the training feasible and acceptable? There's certainly a need for this type of training. The content, like I've said, it was seemed as relevant, useful, and very informative. The open, honest interactions and conversations around mental health and personal struggles and sharing experiences was highly valued. A couple more times, please. Was it effective in educating the importance of mental health? Yes, although it was sort of, to some extent, it was preaching to the converted, because many of the trainees already viewed mental health as very important. Retention of the content in some was very poor, so that's something that could be considered. How could that be improved? And then just hit it a few more times. 2 more times. Thank you. And then did it influence intentions or actions? Again, many of the trainees, perhaps they attended the training because they're already interested in this area and motivated. So perhaps there wasn't huge room for improvement there or change. Some suggested they didn't really take action following the training or unsure how, particularly within the community. So perhaps the training could be guided a bit more specific on the how-to step-by-step guidance on taking action in terms of preventative measures and mental health. Next slide, please. So overall recommendations, they kind of reflect what I've just said there. The training could be more interactive, more specific on the counsellor role, and more step-by-step guidance on community action. And then hit it again, please. That's for the training. For local authorities, they could perhaps build on what the counsellors are saying in terms of the connections that they made during the training, and have buddying schemes, mentoring schemes, support networks, particularly for specific groups like females, minority groups, or inexperienced counsellors, where they can share experiences and they may benefit the most from that. And that's it. Thank you. So on to the final slide, please. So that's everything. Thank you very much. The final report will be uploaded onto the First Light website very soon. So if you want more details, please look into that. So thanks for listening.
Thanks, Aaron. There's one really quick question which you haven't touched upon in the chat.
Okay.
What actions did counsellors take after receiving the training to influence population mental health? Which I know you did touch upon in the conclusions, but is there anything specific?
Yes, I think they generally said that if they were not already taking action already and were involved in initiatives and projects, following the training, they seemed to suggest when they went to the different political groups, committee meetings, they would raise the awareness and generate conversations around how local residents are struggling with their personal mental health, reduction in services related to mental health, and that kind of awareness raising and those kind of conversations in their political group. So I'd say how they can better support their local residents where there is a lack of support. I think that's where action seems to be mostly directed, I would say.
Thank you, Aaron. Thanks for sharing all that. I'm going to rush the agenda a little bit. So I think
Okay.
Go over to Andy for any reflections.
Well, how do you follow that? Thank you, everybody. It's been a really interesting session. It's just great to hear about the work that is happening locally. And Lydia goes to the top of the class for technical abilities. And it's just brilliant to hear about both Bury and Manchester, how you have really embraced public mental health and the importance of creating a mentally healthier community in your place. I know there are lots of other folk here who are doing that in different ways. We'd love to hear more about what you're doing. One of the reasons why we set this network up in the first place is because the knowledge is all out there. There's an enormous amount of commitment and skill and passion in this group. So please share with us what you're doing. We'd love to hear more. If there's anything we can do to help you, let us know. Again, this network exists for you. It's literally here to help you to do your job and to create better mental health locally. So please stay in touch with us and let us know what you would find helpful. It's genuinely inspiring to hear what everybody is doing, and so the more we hear about, the better. And let us know what we can do for you too. There may be other things, other subjects for webinars, other topics that you'd like to hear about during this year. We're incredibly grateful to the Health Foundation that they've got behind us for a third year to do this. So we will keep pushing on. And so yeah, let's keep working together. And my particular thanks once again to my absolutely brilliant colleagues who have worked so hard over the last couple of years. Ed in particular leading this initiative for 2 brilliant years. And stay with us and look forward to working with everyone here in the near future.
Thanks, Andy. Yeah, and big thanks from me as well to all the speakers today, to Jim, to Aaron, to Lydia, to Charlene for joining us. I have shared the link to the accreditation survey in the chat. If you could please fill it in, we'd love to hear what you're doing and your thoughts on it and any policies that you'd like to share. I think what's left for me to say is just enjoy the rest of your day. Thank you for your time. Bye, everyone.
Thanks a lot. Bye, everybody.
Thank you. Bye.
Thank you. Bye.